The mystery dog illness. Now, it's not a mystery. Stick around to the end because I'm going to show you a brand new, very effective home remedy. Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets. There's been this serious respiratory disease that has affected thousands of dogs across North America. Dogs were presenting with signs of kennel cough, but veterinarians were calling it atypical kennel cough. Many of these dogs were getting clinically seriously sick, developing pneumonia in a short period of time, and they were not responding to conventional treatments. Some of these dogs had to go on oxygen. Unfortunately, some of these dogs even died. There's been a ton of press coverage on this. I've done 2 videos to date on this. But now many specialists and some veterinarians are thinking that maybe it isn't a mystery at all. Many veterinarians, they're calling it atypical kennel cough. They're claiming it has multiple causes, including Bordetella, parrot influenza, mycoplasma, etc. Yes, there's been serious outbreaks of canine respiratory disease, but they don't believe there is some new infectious agent that is affecting so many of these dogs. Some are saying it's a combination of so many new dogs acquired during COVID. Then you add in these respiratory pathogens, it becomes fall, winter time, more dogs confined in a small space. They're saying it sets up the ideal conditions to have respiratory disease transmitted. Okay. And for many of the dogs, it's possible that yes, it was some of those same pathogens that cause kennel cough. But what that doesn't explain is how you can take a young healthy dog and in a really short period of time have that dog progress from a chronic cough to severe acute pneumonia, not respond to any of the conventional treatments, having the dog have to be put on oxygen, and then actually having some of these young healthy dogs die. But some of the case reports from some of the referring veterinarians, that doesn't totally back up those claims. Many of the referral centers, when they had these dogs coming in with these severe respiratory signs, especially the veterinary colleges, they were trying to identify the pathogens. And in many of the cases, they were not able to find any identifiable respiratory pathogen, even though these dogs had serious pneumonia and they were not responding to doxycycline, etc. I did read an article where they made the comparison to the first time there was a really big new disease that was affecting our dogs in veterinary medicine, the early 1980s, a disease called parvovirus. When parvovirus first broke, most dogs had no form of immunity. It came from a viral mutation, so dogs had never been exposed to it, and there was hundreds and hundreds of dogs getting affected by parvo, and hundreds of these dogs died because there's no way to effectively treat or prevent it. The claim is if there was this brand new novel pathogen, right now we'd be having thousands and thousands of dogs being affected, and there'd be no way to stop it. We're just going to see this massive outbreak of disease. Possibly. But it could be that so many people are aware of this potential disease, they've kind of modified some of their habits. They're not going down to that busy, packed dog park. I mean, if their dog has any type of cough, they're keeping their dog at home isolated. I mean, it could be there's been specific preventive measures by so many dog parents like yourself, and that's why we haven't had this massive outbreak of respiratory disease. So what should you be taking out of this video? First, it appears there's less cases now of this mysterious respiratory disease. I mean, there are less reported cases. Definitely, there seems to be less concern. Veterinarians have now been better able to successfully treat some of the dogs that have gone from coughing to acute pneumonia. There's an older veterinary drug called chloramphenicol. That's proven very effective with many dogs. I personally still think it's wise to be cautious. I've yet to bring Tula down to the dog walk, and I'm not going to do so at least until the spring. For most dogs, if they develop a cough, most likely it's kennel cough related in terms of being Bordetella, etc. But if your dog does develop an infectious cough, i.e. Tula, she's had no history of coughing, but all of a sudden tomorrow she started coughing, I would be treating her with some of these alternative home remedies. I'm going to show you the 3 I would start with. Number 1, the green tea cough syrup. Green tea, honey, slippery elm, licorice root. This is 1 cup of green tea. I've let it sit and steeped for 20 minutes. Unpasteurized honey, 1 tablespoon. Slippery elm, which is so great for cough, 2 capsules or 800 milligrams. Then licorice root extract. It's got some great antiviral and antibacterial properties and being shown to be very beneficial for our dogs with respiratory disease. 2 ml of the tincture. Mix it well, giving your dog 1 tablespoon per 10 pounds of body weight twice daily. This is a great anti-cough, respiratory disease formula. Number 2, quercetin. Quercetin is a medicinal flavonoid isolated from apple peel, red onion. It's been well documented, shown to be beneficial for viral respiratory disease, and also has antibacterial properties. We have a specific bioavailable whole plant extract. Standard dog dose 50 milligrams per 15 pounds of body weight daily. Number 3, propolis. Propolis is known as bee glue, and that's what the bees use to fortify their hive. Propolis has an array of different medicinal ingredients, and it's been extensively studied. But there's some recent new studies that have come out showing it to be very beneficial for respiratory disease. It's antibacterial, it is antiviral. It also has specific anti-inflammatory properties, so it can help open up those damaged airways. And if I had a dog with this mysterious respiratory disease, I'd be getting myself some propolis. It's very safe, minimal to no side effects. Pretty typical dog dose, 100 milligrams per 10 pounds of body weight daily. 25-pound Tula should be getting half of one of these 500 milligram capsules a day. Should you still be concerned about this, the mystery dog illness? My opinion, yes. But compared to, say, a little over a month ago, I think you can be a little less concerned. And if we learn more, you will definitely be the first person to know. Click up there to subscribe, hit the bell to sign up for notifications, then when you click that link directly in the box below, I can send you a copy of my free book.